Tonight, Georgia's National Guard medical staffers are arriving at hospitals on the orders of Governor Kemp as the state comes close to breaking a new record for COVID patients. This is not the first time the Guard has been deployed during the pandemic, but as Joe Ripley explains, they believe they have an added advantage this time around.
Back in action. The Georgia National Guard got its marching orders last year at the onset of the pandemic. They later helped with vaccinations, and now
we want to go to where the suffering is. And right now the suffering is happening in the hospitals.
Brigadier General Kanata Crumbly says in total 180 guardsmen, airmen, and soldiers are now authorized to help hospitals that have become overwhelmed in recent weeks that are experiencing staff shortages and a surge in COVID patients.
We really need sort of medics to help triage the people in the emergency room, to help start IVs, check vital signs, and just, we're backed out into our waiting room of our emergency room.
The state also committed to pumping $625 million to pay for support staff and more hospital beds through the end of the year. Crumbly says the Georgia National Guard will supply medics, nurses, and administrative personnel based on a hospital's needs. Their duties will include entry control, processing, and patient care.
It was our first pandemic, last year. So now we're here for round two. And we want to make sure that we're in front of things instead of reacting to them.
Crumbly says he hopes the Guard's deployment resonates with people and encourages them to get vaccinated to take stress off those helping on the front lines.
This pandemic doesn't care about race, sex, gender identity. It doesn't care about any of that. It will infect you and it will hurt you, and in some cases it will kill you. The best thing that you can do to protect yourself, and here's the key part, and the others around you, to include your loved ones, is to wear a mask and get a vaccine.